Fine. Okay, I am Amanda Greer.
I'm Sarah Lewis.
I'm Stacey Anthony.
I'm Ashley Cook.
Okay, and Sarah, did you want to start with the patient
Yes.
experience?
So, patient experience for the definition that relates is it's a range of interactions that a patient has with the healthcare system, whether that be private physicians, hospital staff, or other healthcare facilities such as specialties, things of that nature, imaging.
And Stacy, do you want to do the next one?
I said staff should be trained more on communication skills, not just as far as training walking into a patient's room and saying, "Hi, my name is," and what their role is and what procedure they'll be doing on patients, but more engaging patients in conversation. And by doing so, it would alleviate more anxiety and stress. And by doing that, it would also make the patient's blood pressure levels go down, their pain threshold go down, and it would just be overall ease their experience, and their experience would be much better.
And the HCAHPS is a hospital consumer assessment of healthcare providers and systems survey used to measure patient experience as well as their perceptions. That info is then used to create new initiatives to improve the organization with new incentivized plans to help the organization heighten quality of care. And then that turns into improved scores for the survey.
Okay. And the patient experience that are hard to measure are empathy and communication. With empathy, it's kind of hard to it's something more like how do I explain? Sorry, I wasn't really prepared into that one. It's not something you learn, it just happens with patients. Same with communication. Your tone of voice is everything with them.
Mm-hmm.
That's what I think are hard to measure sometimes, because you could be having a bad day and your tone of voice can change how the whole perspective comes out with a customer.
Right.
I agree.
So yeah, I think those are kind of hard to measure sometimes with patient experience.
All right, so I guess we can jump into our cases now. I had the first case, so I'll go over mine first. And my case study was at Cape Coral Hospital, and their challenge that they had was wanting to communicate with the community and all the members throughout the health system. They created, they meaning an administrative officer there, created a CEO blog that engaged people and helped to facilitate a better patient experience, enabling the organization to become more patient-centered. The administrative officer who started it connected with two CEOs of other organizations that had blogs already in the works to get insight from them. And they both basically stated that to have the CEO's voice incorporated into the blog was really important. 2 years later, after they rolled out that blog, it encouraged engagement for both the staff and the physicians. And due to that encouragement, patient experience scores elevated. The blog allowed patients to gain perspective and develop deeper understanding of the hospital's mission.
Okay.
And Ashley, I think you had the second one.
Yes, mine was the Coleman Regional Medical Center, and they faced one of the most important transition of a caregiver. So they had an issue with patients understanding their discharge from a hospital. You know, it can be difficult at times for the patients and their families to understand what the discharge means. So they did a study where if they filled out a survey, about how comfortable they felt with their patients, that 30% are less likely to revisit without any problems.
Oh, okay.
That was my case.
Well, yeah. I know that's usually
discharged from a hospital. There's a lot of miscommunication. Like they don't know what's going on, or like where they're going to go next. So they filled out a survey where if they knew more information about discharge, would they feel more comfortable? And they said yes about going to a hospital.
Yeah, I agree. 'Cause I know that can be challenging sometimes.
Difficult to understand as well.
Okay. So mine was from Duke Riley Hospital. And the way that they improved their patient experience was implementing bedside barcode scanning for medication administration processing. So patients who normally would get medications who were inpatient, their old system, they used a handwritten paper chart and it was passed from shift to shift. They noticed a lot of inconsistencies with patients getting either the wrong medication or the side effects weren't being caught prior to the medication being administered, and it was causing adverse reactions with the patients. So they implemented this whole new barcode scanning process where the nurse or the doctor, whoever goes in with the patient, every patient is giving a barcode scanner on their wrist that they wear. They scan that, and a list of the medications that that particular patient was taking, the dosage amount and the frequency would come up, along with the side effects if they were on multiple medications. That reduced a lot of risk for patients having adverse side effects. It also implemented that the patients were receiving the correct dosage amount and the correct medication and at the correct time frame. So whether one nurse in a shift change, a new nurse came in, as soon as they scan that barcode, they know exactly what they're looking for, they know exactly what they need, and they know exactly how much to give them. This alleviated a lot of concerns with patients just because of the what if factor, or if they don't get their medication in a timely fashion, or if they get too much, or if the nurse comes in and gives too little. It kind of flatlined all of that. So it definitely relieved a lot of patient stress, and as well as stress between the administration staff who were giving out, the medication, the doctors, things like that, kept record of everything. So there was no question of if the nurse forgot to write down when she gave it or how much she gave, they wouldn't have to backtrack. Everything is right there electronically. It alleviates cost effective. It's very cost effective. It increased the value overall just because they weren't going through a lot of money trying to order certain things that weren't necessary. Everything is electronically recorded into the patient's chart so it can be documented and viewed. And it just kind of makes a whole smoother process for the patient, the administration staff, the providers, the physicians. It just makes it all around just a much more smoother experience.
And it sounds like it makes it a smoother experience, but also helps with the safety factor of everything.
Right. One of the things that they did do is they have a pharmacy that they did a contract with who would go in and implement the side effects, adverse side effects reactions to certain medications, especially narcotics. So if a patient is taking a certain medication, controlled substance, it would list what those possible side effects are. If a patient has certain health factors like heart disease or blood pressure or diabetes, what certain medications could do to a patient's health factor. So that definitely brought down a lot of stress and worry and concern for patients because everything is right there for the nurse or whoever is administering the medication, they have everything right in front of them on their computer screen.
Ashley, I had a quick question about yours.
Yeah.
Did it say for that survey, what did they do with the survey results? And I'm sorry if you said that. I was just circling back.
Oh no, you're fine. So to do the survey results, after they got them back, they just put into a computer system, and they. Sorry, that part got sidetracked. So yeah, basically they took the information and then they had a group meeting about it, and it's pretty much a better way how to communicate better with the patients.
So they took feedback from the surveys to create a new plan.
The surveys would say like, how did you feel on your visit? Were the nurses being polite? Did you get all the information you needed? Did you understand the information? Did they go over the information with you? How was your visit? Like, did you understand? And someone would say no, yes, and then they would take that information and then they would go from there to provide better service for them.
And did it say anything about if somebody answered no to something, would somebody then be reaching out to them to help them, or it didn't mention that?
It did not say, because it said it was just anonymous. So, but they took it all yeah.
Okay. All right. Stacy.
Alrighty. Mine was UC Irvine Healthcare. And in 2006, they transitioned from a relationship-based care to provide a more patient-centered care, where it's for the oncology unit, where every time the one person into the hospital, they would be assigned to the same nurse each time. That way that nurse knew the patient's history. They knew everything that was going on with that particular patient. They kind of got to build a relationship with the family. And in 2006, they were ranked 58th in a 50% out of 72, it said. And in 2010, they had moved up to the 87th percentile by doing it this way. And they said that the scores improved so much because communication improved between the staff, just because it was the flow of the unit improved so much. The flow between the flow with the patients, the relationship between the patient's family and the nursing staff, it became more of a family unit versus a patient coming to the hospital to just be treated for cancer. And they said the unit increased in communication and confidence, not just among the staff, but also with the patients. And so far it says that the UC Irvine has been on the list of America's best hospitals for 10 consecutive years since starting this program.
That sounds really good. I know everybody, if they could help it, would love to be able to see the same people every time they come somewhere for care, because that does give more confidence, because it's not like you're dealing with a stranger. You feel like that person knows you because you build a relationship with them, versus coming in every time and seeing someone different.
Plus, they already know your patient history. They know your medical background. So they're familiar with what you're going through, what your medical history is.
And they
and I mean,
your dislikes.
Granted, everybody can see your history, hopefully in the chart. It still adds to that by having the same person versus a bunch of different people and them just learning about you from looking at your chart.
Right. It's a more of a personable experience.
Yes, that's a good word for
They
it.
get to know you. Yeah, they get to know you on a personal level, and one nurse might not connect with a patient, but another nurse might. And if they don't mix, like their personalities don't mix, then they would be assigned to a different nurse. And then that nurse would continue the care.
Oh,
That's neat.
Yeah.
I like that.
so for the next part where we have to decide on a program out of all four of these to use as an example for our webpage, I'm thinking Stacy's, but that's just me. What's everyone else think?
I definitely like Stacy's.
Yeah.
I like Stacy's, and I do like case 3, the one that I did, just because of it offers a consistency that patients can respect and kind of appreciate. But I definitely
I like Sarah's because of the safety issue of it. But for the the topic that we're doing for experience, I like mine.
Yeah.
Right.
Yeah. Great.
I agree with
So since we all agree on hers, now we have to create our web page. So the page, I don't know if you guys are all still looking at this, but each one of these bullets has to have 1 or 2 paragraphs, one for patient experience definition and key factors, the HCAPs, and then basically everything that we went over. So
yeah.
I think it's easy enough to everybody take the bullet that we went over because it works out. The last one is Stacy's case anyway, so she can write a paragraph or 2 about her case. Sarah, you can write about patient experience and
Got it.
Key factors. Don't forget the key factors. I'll do the HCAPs, and then Ashley, you can do patient experience and measuring why it's hard to measure and why.
Okay.
And then how much time does everybody think they need for this? Because you can type up yours and then send it to me and I'll make it look pretty and submit it.
I mean, I can have mine to you probably tomorrow afternoon, if not tonight.
I could probably have mine tomorrow night.
Okay.
That sounds good.
Excellent. Great. Well, I'll look forward to your emails. It was lovely meeting you all.
You too.
Okay, well, I'll talk to you in email.
All right. Have a good night, everybody.
Bye.